All right, good afternoon to us all, and you are all welcome once again to another episode of Health Talk on Promise City TV. My name is Abigail Kwe, and I'm your host for this program. It's always a delight to host you on this program, and it's a privilege and a great pleasure as well. And I'm most grateful to the CEO of Promise City TV, who happens to be Apostle Mrs. Benes Ajiman Prempe. I really appreciate you and thank you for this great opportunity to host this program. And also thank you for the host of programs that you've allowed on this channel to be a blessing to us and our audience. Okay, so if you are joining us for the first time, I'd like to introduce briefly to you what PCTV is and what we're about. So, Promise City TV is a Christian channel with a vision of spreading the gospel of Christ throughout the world. And it's also dedicated to providing quality Christian programs, including spiritual teachings, studies, prayer sessions, among a host of other programs, also including the health and wellness talk. So on this channel, we have Bible studies on Mondays at 7 p.m. And then from Monday through to Friday at 11 a.m., we have Visitation Hour with Apostle Mrs. Benes Ajiman Prempe. And every Wednesday at 7 p.m. is Exaltation Hour with our sister Arabi. And Thursdays is Inspirational Hour with Pastor Jessica. And Sundays at 4 p.m., as we have now, is the Health Talk on Promise City TV. So you're always welcome to join us on this channel at any of the times, as I've mentioned earlier, to you to be blessed. Okay. And so, as I mentioned, Apostle Mrs. Benisajiman Prempe, as the CEO of this channel, she's also the founder and general overseer of Promise Land Faith Ministries. And I'd like to touch on the programs that she has throughout the week. And she's blessed to have three temples of fellowship. That is Dominion Temple, located at Dojum of the Shah Hills, Akosombo Road, Victory Temple, located at Ashama, Atadeka, and Faith Temple, located at Tema Community 1 behind the Goil Filling Station. Every Wednesday at 10 a.m., she hosts Faith Hour at the Faith Temple, Tema Community 1. So if you happen to be within Community 1 or within Tema, on Wednesdays and you would love to pass by, kindly do so and we'll be blessed to receive you. Then on Friday is manifestation half night every Friday. That is starting at 7 p.m. Also held at the Faith Temple Tema Community 1 behind the Gold Filling Station, except the last Friday of every month where we all gather at Dominion Temple Dojum of the Shah Hills, Akosombo Road for an all-night session. And for this Christmas, it's a lineup of special activities. We started yesterday with a carols night. It was a blessed time. And on Thursday, which is 25th, which is Christmas Day, we're going to have a glorious service in the morning starting at 8 a.m. Then on Friday, 26th, is manifestation half night starting at 7 p.m. And on Sunday, 28th, is going to be crowned with victory service also at 8 a.m. So please do join Apostle Mrs. for a blessed time this Christmas. Okay, so back to Health Talk. Today, we honored to host a nurse, and she's from the Tema Port Clinic, and she'll be talking to us about tonsillitis. It's a long-awaited discussion, and thankfully, we're going to have it today. So, without wasting much time, let me welcome our very own Grace Tete, a seasoned nurse from Tema Port Clinic. You're welcome, Grace.
Thank you.
Okay. It's a joy to finally have you join us. Though far not in the studio today, it's a blessing to have you. So can you tell us briefly about yourself or what you do at Maport Clinic?
Okay, I'm a registered general nurse
Okay,
at the Port Medical Center. So basically, that's what I do. I haven't yet specialized,
okay,
though it's in my future plans.
all right, okay, all right. So today we're going to talk about tonsillitis. It may most people might have heard of it, but have not heard much into details, what causes it and all that. And some of us on the call may attest to it that you may at some point had some sore throats, have difficulty in swallowing, or you had some swollen glands. And we want to know, when should it be a worry or a concern if you should experience some of these symptoms, and how we can manage it properly, especially when it comes to children as well. So she's here to help us understand this topic and how to prevent it if possible, and if you should have it, to how to handle yourself in such a situation. So let's start off. When we hear tonsillitis, what exactly is that? Could you help us understand that?
Okay, so before we dive into what tonsillitis is,
Mm-hmm.
people might maybe ask them, what is tonsillitis? So we'll have, so when we talk about the tonsils, it
Mm-hmm.
is a two oval-shaped lymphoid tissues at the back of our throat. When
Okay.
you open your mouth, you see it's like two oval shape. So
Mm-hmm.
at the back of our throat. So these tonsils serve as the first defense in our immune system. So anytime there's any pathogens or bacterial injection, these tonsils serve as our first defense um, mechanism in our immune system. So when we talk about tonsillitis, it's basically the inflammation of our tonsils. So this is called tonsillitis. Thank you.
All right. Okay. So I'm trying to pull up a picture, and probably that will help us understand it better. So while I pull it up, can you tell us is it always caused by an infection, or what causes tonsillitis?
Also, when you look at the causes, we have bacterial, we have viral. Viral and bacterial cause can also cause tonsillitis. So
Okay.
we have, so let me say the infectious causes. So the
Okay.
infectious causes, we are looking at
Mm-hmm.
the viral infection. Then we look at the bacterial also. Then we look at fungal. So these three things are some of the main causes of tonsillitis.
Fantastic. Okay. I think I can show the picture to help explain it better. So could you walk us through it again with the image now?
So now these are the tonsils. Looking at it.
Mm-hmm. Yes, Grace, you can go ahead.
Okay. So pointing with the arrow, we could see that just at the back of our throat.
Mm.
Yes, pointing with the arrow. So these are the tonsils.
This one on
These
the
are the tonsils. The
okay.
one, no, those ones are, yes, those are the tonsils that we have. Just at the back of our throat. It's two. So it's in the form of an oval shape.
Mm-hmm.
So that's it.
There's an
So
over.
the oval shaped tissues over there are our tonsils.
Okay.
Looking at the normal one over there and
Mm-hmm.
the abnormal one you could see, but we would come there, we will get to that place when at the course of our presentation, we'll
Okay.
get to that side. So
All right.
these are our normal tonsils.
Okay. All right. So you're talking about the infections, the bacterial and then the viral. So can you help us understand the difference there?
Okay, so when we look at the causes, so we
Mhm.
have viral. The viral is due to viral infection. So the viral infection, we are looking at something like coronavirus, which is the normal thing that most of us have heard. And we look at the adenoviruses, the rhinovirus, influenza, Epstein-Barr virus are also all kinds of viruses that which if one if one is exposed to, the person would um, get tonsillitis, or the person is at risk of getting
Ah,
tonsillitis when
okay.
it comes to the viral.
Okay.
And when it comes to the bacterial also,
Mm-hmm.
it's also can be caused by a bacteria called streptococcus bacteria.
I think
So
that's
this
yeah.
streptococcus is a bacteria that when you ingest into your system, or when you come in contact with it, you can also be at risk of getting tonsillitis. We have another bacteria called staphylococcus aureus.
Mm-hmm.
It's also another bacteria. When ingested or when you come into contact with, you are going to get it. And then we have fungal, another fungal infection also. So any form of fungal um, contact you come across, you can also get it. You
Okay.
can also be at risk of getting tonsillitis.
Okay. Let me dwell a bit on the bacterial infection bit of it. You mentioned the staphylococcus, right? And then the first was
Streptococcus.
streptococcus. Okay, so the strepto and then stuffy. Let me give you those nicknames. So with those ones, how does someone come in contact with that? Just to look at the
Okay,
prevention measure.
so we in our normal setting, bacteria are everywhere.
Okay.
These bacteria can be found on our food. It can be found on surfaces.
Mm-hmm.
So if you can remember, during the COVID-19, though it's a viral, it's a virus, but during that era, you could see that um, you will see people wiping their um glasses. I don't know if it handles, door
Yeah.
handles. You
Yeah.
could see that you see people wiping it every day. You
It's
see people washing their hands every day, trying to also get warm foods to eat. So these bacterial settle, they can settle on either animate or inanimate
things.
um, objects. Yes.
Mm.
So these are some of the places where you can pick the virus,
Okay.
the bacteria.
Okay.
And you can't see them too. These bacteria, you can't see them.
No, not with our naked eyes. And is it does someone come into us they come into
Lenses
contact?
around, so you wouldn't see them. So you end up picking them up
Mm,
in in animate or inanimate
okay.
pieces.
So I was asking, as you've explained about the
Hello, please, you
bacteria
said.
bit. Can you hear me? Hello.
Hello,
Yes, Grace, can you hear me?
hello. Yes,
Yes. So about
yes,
the
please.
bacteria parts, I was
I can hear you. Can you hear me?
yes, I can hear you loud and clear too. So I was asking about the bacteria bit of it. Is it that one can get infection through only ingestion? So probably they've touched the surface that has this bacteria and without washing their hands, take in food and ingest it. Is that the only means by which they get this bacterial infection, or is through other means?
Okay. Through injection, you can get. It's not only about injection.
Okay.
So droplets,
Okay.
droplets.
Mhm.
So you see somebody sneezing,
Oh,
then you inhale it.
okay.
You get it.
Mhm.
Somebody might be having, because when you have tonsillitis, it comes with this cold, catarrh, running nose. So
Mm-hmm.
you see people, and others also cough.
Okay.
So through droplets contact you might get, and
Okay.
injection too.
Okay.
So these are some of the things that
It can
can
be.
also be at risk of getting it.
Okay. So now let's look at the some of the signs and symptoms of tonsillitis.
Okay, so the signs and symptoms, we are going to see, one is going to experience sore throat. So it's often, sometimes it can be acute.
Mm,
So like the pain, the sore throat wouldn't be that, you feel just a minimal hoarseness in your voice.
okay.
Then in a severe way, it radiates to your ears. Sometimes when you have this sore throat, you could feel that like it's radiating to your, when you talk, you could hear some tingling sensations like that in your ears. So these are some of it. So sore throat is one. You have fever or chills. When you talk about fever, so high body temperature, you have, then chills. So chills, you'll be feeling, you'll be um sorry, let me, so people will be saying that I'm feeling cold. I'm feeling cold. Though what you see that the weather is very hot, but because the person is going through that, the person will be experiencing chills and fever. There will be something like halitosis. So when you say halitosis, that makes halitosis simply means bad smell from the mouth.
Oh, okay.
Bad smell from the mouth because the place is inflamed. And some people, there is kind of exudates. So when you say exudates, you see some pus formation around the tonsils. And when there is an exudate, it comes with a smell. Yeah, it comes with a foul smell. So
Mhm.
anytime you open your mouth to talk, you could, anybody around you could smell that. So there
Okay.
is halitosis.
Can I
Yes.
come back
And
to
there is
that?
voice change.
Is that what you were talking about in the picture?
Yes.
Yellowish.
That's what I'm talking about. Yeah.
Okay.
Yes, yes. So that's the exudate, the
Mhm.
pass. It's a form of a pass. Yes, so around it in severe cases, in very severe cases. So that's it. So there is voice change. Your normal voice is going to change. It's not like, some people, they'll go and sing, you go and sing or you shout, or some people go through stress and they will have this hoarseness in their voice. It doesn't mean you have tonsillitis.
Okay.
No, but so it doesn't mean you have tonsillitis. But when you experience tonsillitis, there is a voice change, obviously, because you'll be having pain and there'll be a voice change. Then there'll be children may experience nausea and vomiting.
Oh,
Nausea and vomiting, yes. And some people also may experience pain, abdominal pain.
okay. Does the nausea and vomiting also occur in some adults, or it's only a symptom for children?
Oh, some adults can also experience it
Okay.
because when you have this tonsillitis,
Mm.
one, there will be difficulty in swallowing.
Yeah.
And because there is a pus formation at
Mm-hmm.
that end, so anything you take in, you wouldn't like have that kind of edge of swallowing food with a normal tonsils.
Mm-hmm.
So you'll be having this kind of nausea,
Okay.
and you wouldn't feel or have any appetite to eat.
Okay. All right.
And others will also vomit. Obviously, when you have nausea and you eat, by all means, you have that edge of bringing out whatever food or whatever thing you've ingested into your stomach.
Okay. All right. So I think with this, once we notice such symptoms, do you have to rush to the clinic when you see such symptoms, or you can go to the pharmacy and get drugs over the counter?
Okay, so In tonsillitis, we have acute and chronic. So with the acute, sometimes the acute, after you've ingested the pathogen or after you've come into contact with it, our
Mm.
immune system is there. Our immune system fights against any kind of diseases that our immune system fights against any kind of disease that comes into our body. So
Okay.
when it comes, when you ingest the pathogens,
Mm-hmm.
sometimes your immune system fights against it.
Okay.
So you get some of the symptoms like maybe mild headache,
Mm-hmm.
then maybe difficulty in swallowing or in the hoarseness. But within sometimes it takes like 3 to 5 days,
Mm-hmm.
it's gone because your immune system has automatically fight against it.
Yes, this. Okay.
Yes. But in a case when after 5 days or after 7 days, you are still experiencing it, then I think you should quickly go to the hospital. You have to visit the hospital.
Okay.
Okay, over the counter, getting back to your question with over
Mm.
the counter medication.
Yeah.
So people usually just go to the pharmacy and get their analgesics. So PMO, they take and for the pain,
Mm-hmm.
they just rush in, they get it. After taking it, they feel that oh, I'm okay. Then it goes. They are being relieved. So people usually go there to get it. But after you've gone to the hospital and after you've gone to the
Pharmacy.
pharmacy or you've gone to yes a pharmacy or visited any um drugstore to
Mm-hmm.
get any sort of PMO and you've taken it and you are still not getting well or you are still experiencing the pain, then the only advice, which is 100% assured, is to visit the nearest hospital or clinic
Okay.
to get treated.
Okay. Because it's an infection, and the infection needs to be treated, not the pain. The pain is as a result of the infection. So you need to attack the infection instead of just the pain someone is having. Okay, so are
Yes,
there any lab
yes.
tests? So should a person walk into the hospital, do you do lab tests to confirm if your suspicions of tonsillitis is the case, or the other tests that can be done? How do you diagnose it?
Okay, so before you get to the hospital,
Hmm.
first your samples are taken. So there are some labs that you do. First, we do FBC, full blood counts.
Hmm.
Then we look at your um, white blood cells.
Hmm.
So if there is an increase in your WBC, so white blood cells, then it indicates infection.
Okay.
So the full blood count is going to check all that.
Mm.
Then we do throat culture. So sometimes a sample is taken from your around the tonsils. You know the parts I talk about,
Pass.
the exudates. They just take a sample,
Mm-hmm.
yes, to the lab to check it. Then there is something called rapid streptococcal antigen test.
Mm-hmm.
So that one too, when you get to the lab, they do it. So that one, they are going to figure out, the streptococcus
Mm-hmm.
is a bacterial, it's a bacteria. So this test is being done to indicate if whether it's a bacterial infection or a viral infection.
Okay. Okay.
And other tools, people also do imaging.
Mm.
So they'll do CT.
CT. But
Yes,
that would be a very
CT scan.
serious
Yes,
case in serious cases.
they're in very severe cases.
Wow.
Some usually have a very severe tonsillitis. And you'll be like, hey, how did they sit at home to wait till it gets to because One way or the other, okay, looking at me, I have suffered from tonsillitis, especially with my early childhood. This is one of the condition I've really suffered from it since childhood, like from early childhood, let me say. So
Mm-hmm.
I think because I like playing a lot and I like
Easily
playing in the
the
sand.
infection.
So, so it was one of my first um conditions I've been experiencing from. So in normal severe cases, you have to do CT
TT. Wow,
to check.
that's interesting to know. Okay, because I do a bit of imaging too. That hasn't come across to me yet. So to know tonsillitis may require a CT scan, and that shows the severity of the condition in some people, and it shouldn't be taken lightly. Okay, now as we've done with the diagnosis, when it comes to treatment, what are some of the treatments given to relieve the pain, the symptoms that are experienced by anyone who is affected?
Okay, so looking at the treatments, when you
Mhm.
get to the hospital, you are being given antibiotics.
Okay.
So they give you those antibiotics to counter whatever is going on with you. And for the pain, you end up giving you the analgesics. So the analgesics will take P-ball or any form of analgesics that will be suitable for you.
To relieve the
So
pain.
you'll be given that, yes, to relieve the pain.
Mhm.
So sometimes hand in hand, we treat, especially with the viral. So
Mhm.
the viral, because mostly the viral, we allow the immune system.
Mhm.
The immune system also plays a major role. So
Okay.
you can be taking your antibiotics. You
Mhm.
take your antibiotics, you take your analgesics. Then the immune system will also serve as a defense mechanism to counter it.
Okay. All right. Okay. I think that helps. So, someone who may have experienced tonsillitis, is it likely to reoccur?
Yes, it's likely to reoccur. Some people usually have this reoccurrence. They
Mm,
have it, then they'll go back. They have it and they'll go back. So it's some people really have this kind of reoccurrences. And these people, that means for them, they are just going back to the chronic end, especially when you don't finish your antibiotics.
okay.
You know, antibiotics, when you start, it's a full course
Full
treatment.
course that needs to be.
So you just need to finish it.
Mhm.
Because the moment you build resistance to the antibiotics, then you should know that you are going to another stage. You are now going to start all over again.
With a different kind of
So it's going to be your fault. Did you say?
with a different kind of medication, which may be more costly.
Yes, with a different kind of medication, which is going to be costly. And this antibiotic resistance is also an issue to talk about later.
Mm.
Because you see people just abusing it. Some people have also made themselves like like let me say, a homemade nurse, homemade practitioners. So they just have this pain and they'll tell you, oh, I'm going to the pharmacy or the drugstore. They just go there and then just go, oh, give me antibiotics. They'll just tell you what they want. Then they'll give it to them.
Yeah, that
Because of how
that
our system,
works. That was
because
the
of
thing
how
I was
our
going to ask
system,
with regards to the reoccurrence, because for someone who has experienced it before, knows the medications that were given, these antibiotics and the paracetamol you mentioned, there's a class of name you mentioned for that, for the pain relief. What was that again?
so analgesic.
The analgetics. So if I had tonsillitis some months back and it reoccurs, I could easily walk in and then request for, say, medications. Would you recommend that?
No, this is not done anyway. The moment there is a reoccurrence, then you have to visit the hospital because I've mentioned that some are caused by viral, some are caused by bacteria, even fungi. So you don't know. So you just don't have to go to the pharmacy or any drugstore. You just go there and go and pinpoint. For all you know, you might not have completed the course.
Yes. That's why it
You
reoccurred.
might not have completed the
Okay, what if
course.
I
Though
said,
the reoccurrence can come. Some people usually complete their
I thought,
antibiotics, but there is a reoccurrence.
mm-hmm,
Yes, there might be an instance like that. But another instance can also be like the person hasn't completed the medications which was given.
giving them.
Yes. Yes, so there might be reoccurrence. So I remember, let me use myself as an example.
Okay.
I had instance like this. I
Mm-hmm.
had the hospital. Mine was very severe. It was very, very severe. I can't swallow. I can't do anything. I can't eat. I have this dry mouth. And because you are not eating, your lips will be dried. Even to take water, you can't. Just even swallow your own saliva, you
It's okay.
can't. So I visited the hospital. I was given the medication. And because by then sometimes around 10 years, 11 years, 12 years, your parents might leave you to just take your medication because they know that you are aware. They've shown you what to do. Oh, take, because your parents are not always going to be at home to be
To
directing you
survive
that
that.
take this, take this. Yeah,
Mm-hmm.
they wouldn't be around. So myself as an example,
Mm-hmm.
um I wouldn't finish the medication, especially with the antibiotics. I wouldn't finish it. The moment I realize that, oh, now that the pain is gone,
Gone.
then I'll just pack it somewhere. So there will be reoccurrence. I'll go back again. When I go again, they'll give me the medication. Sometimes they would have to change the antibiotics for
Mm.
me
Because you're
because
becoming
I would,
resistant to the ones we administered earlier.
yes, they would have to change. You come back home. I wouldn't finish it until one day I was caught.
The
I was caught when my
nurse
mom
has
had
been
to
caught.
tell me, go and bring your medication. So we had a basket at home where we put all the medications inside, all our medication. So you put it in a rubber and you label your name on it
On it.
aside. Yes, so it's packed. When you come in, go and bring your medications and let me see. That was when I was caught. And you can see what happened. You are sick and they'll be beating you on top.
Wow, that's interesting.
So when you have this reoccurrence, it doesn't mean um
Self-medicate.
it's because you didn't complete your course or but you have to just visit the hospital.
Okay. Is it possible to that the first diagnosis was a bacterial infection and then the reoccurrence could be viral or fungal? Is that possible?
Yeah, it is very, very much possible.
Okay.
It is very, very possible because we have these viruses around, like the coronavirus I talked about. You
Mm-hmm.
go to the hospital and they tell you, oh, maybe it's a bacterial infection
Mm-hmm.
and you'll be treated. But later on, along the way, you had coronavirus. So
Preaching
you
to
go back and you'll be experiencing this kind of thing. But sometimes it has an influence in our respiratory tract.
mm-hmm.
So our upper respiratory tract. So there is something called upper respiratory tract infection.
Mm-hmm. Mm-hmm. Yeah.
So breathing in from the droplets that you are being exposed to, like people coughing, sneezing,
Mm-hmm.
yes, this kind of droplets. Some can even, spitting around,
Yeah.
just spitting. Some people will spit. You'll be walking by and someone will just spit and hey, and there is air blowing. So the
Yeah.
moment the person
Droplet,
throws this saliva, yes, you see that some will be just, is it flying about? Before
droplets.
you realize it will land on your skin
Yeah.
and some around your nose, your nostrils, and you'd have to breathe in.
Mm.
Even some on your lips. If you are not careful, you might think, oh, my lips are dry. Let me just use my tongue to.
Lick.
Yes, and before you realize, you've taken some,
Mm.
you've ingested, you've. So that's it.
Okay. I think proper hygiene should be practiced. I mean, we
Yeah,
learn
and so
in
even
school.
with our ears too,
Oh,
the same thing. So
oh,
yes, people you ingest, you play, especially with
the
children.
children.
Children they like playing in sand.
Mm-hmm.
So they like this kind of they're playing in sand, and though you see them playing on the floor,
Mm-hmm.
some will just get hold of anything, then they will just put it in their mouth. Some would, and kids, so they like playing with their eyes,
Mm-hmm.
their nostrils. They'll be picking their nostrils. Some will be um putting their hands in
Yeah,
their
yeah.
ears.
They can easily
Others will be
the
using
bacteria.
yes, stick into their ears. And all this, there are these bacterials in your hand. You might not know where they had it from. Maybe, you don't know where they had it. And they wouldn't also know
They
if
can't
there
tell.
is bacteria in their hand.
They can't tell.
They can't tell. So before they realize, their hands are in their ears.
Mm-hmm.
Their hands are in their mouth, their nostrils, their eyes.
Oh my.
Then it quickly gets there. Then that's it.
They become
Then
infected,
tonsillitis
sets in as well.
becomes one of the things
Well,
we are going to get.
that as well. Okay, so back to the treatment. You've talked about the antibiotics, the medications that are given. Um, does it come to a point where
Okay.
someone will have to go in for surgery or any other medication and any other treatment modality aside the medications given?
Okay, yes. Yes, it's true. So people have to go for surgeries, especially in a very severe
Yeah.
ones.
Okay.
So there is a surgery sometimes called tonsillectomy. So they have to go and remove your tonsils in a very severe cases. In a very, very severe cases, you have to undergo surgery
Okay.
to take out your tonsils.
So when the tonsils
So
are taken out, well, I know at this point it's been infected and needs to be taken out. Doesn't the tonsils play a
yeah.
very critical role in our body, such that when taken out is going to affect the body's functioning?
Okay, so these tonsils, I say, they serve as the first defense mechanism in our body.
Okay.
Since it has been taken out,
Mm.
so obviously, you are going to be on medications to at least help with that. To because since they are there as a defense system to help you. So when it's taken out, there are
Mhm.
some medications they'll be giving you. Because obviously you can't say you are not going to eat again. By all means, you eat something, you take in something. But when it's taken out, um, some medications are being given to you, yes, to you.
Okay. All right. That's well understood. So would you suggest any lifestyle or hygiene practices that can be carried out to reduce the risk of being infected or having tonsillitis?
Okay, so our prevention, we will talk about practicing good hand hygiene. So you wash your hands. Someone say before and after everything. Before and after. I can't remember even during the COVID-19. Even if I'm going to the washroom, I have to wash my hands before I visit the washroom. And
And
after
after, oh, that's good
and
practice.
after visiting, I have to wash my hands again
Mm-hmm.
because it was really scary at that time.
Yeah.
So you have to practice good hand hygiene. Then you have to also, if you smoke too, when you smoke, you'd also be at risk. It increases the rate of getting it. And also um taking warm foods can
Okay.
also help.
Okay.
Yes, taking warm food. You don't have to wait for your food to be
To run
cold
cold.
for you to take it. So you need to be careful with that. And obviously also taking cold, excessive drinks, cold
We
drinks.
want a cold cold drink.
Bacteria like places that are quite cold.
Okay, they
This is
thrive
a
there.
place that
Mm,
there's damp areas.
okay.
So for that places, you see them like multiplying because that places are very good um
Condition
environment for them
for
to
them to thrive. Mm,
multiply. So you should be careful of
mm.
the cold drinks that you take because they can easily settle around it. I went to and say in our canned foods, sorry, our canned meals,
Mm-hmm.
our canned foods, let me say too, we should also be watchful about it. Especially when you're going to take, you have to look at the expiry dates.
Okay.
The expiry date. I can't remember during my service at 37 Military Hospital.
Mm,
So I had a colleague of mine. She said she went to buy um, malts. She was hungry and went to buy this canned malts, not the plastic one, the canned one.
the canned ones. Yeah.
So the canned one. When she opened it, she took the malts. Then I don't know what happened. She was like, let me look through the can and see. And when she looked through it, she saw this kind of, I don't know. I think I don't know if it was rusted. It has and had these black spots in the can. So she said she opened it. She was telling me the story about, so she opened it, and when she opened it, she was like, what? So she even had to, she experienced this stomach pain because
But she has ingested
there
it
was,
already.
yeah, she has already ingested it already. She has ingested majority of it already. So we should be watchful around it. Some people, when you just go, you just get your mouth. You didn't even check the
The price.
expiry date.
Mm.
Then you just take it. In the market, they will be shouting, "Don't call me." Some market women they will wait, or especially even in our major stores, when the product is about to expire, maybe it's 2 months more for it to expire, then they will have to put it in the market, or even some dates for
Mm.
it to expire. They'll put it in the market and they'll reduce the prices for everybody to get. So if somewhere, original sale is like 10, and coming to the market, you seen that, oh, they are doing promotion, two cities,
Mm.
three cities, you get hold
Flash
of
sale.
it and you will take without checking the expiry because I'm saying that some promotions they make out there necessarily means that the products are expired.
Mm.
No, it doesn't mean like that. But we should also check the expiry date of our products that we get. And also the coldness of it, you need to be watchful about it because they can easily multiply from that end. Um, so vaccination also to prevent this kind of things. So vaccinations are also good for you to take. So like the COVID-19 vaccine that came out,
Mm-hmm.
a lot of people really did justice to visit the hospital to get
Yeah.
vaccinated. But you know, when you are supposed to take 100 population or 100 people, you might still get like 5% or even 10% or even let me say 20% of the population not taking their vaccine.
Okay.
Even with the COVID-19, up till now, a lot of people
That's
haven't visited the hospital for their
vaccination.
vaccination, and it is there. So vaccination are really, really important. So
Yeah. Yeah.
these are some of the
If-
preventive ways
okay.
that you need to do so that you don't get it.
Okay. Thank you so much for those pointers. So you touching about the cold food. Does it mean or can we relate to it that cold weather causes tonsillitis? And have you had a lot of cases during the cold um season?
Okay, yes. So we usually get some cases like that, especially when it's in a rainy season.
Okay.
It's in a
Okay.
rainy season. The weather is cold, and as I said earlier, bacteria
Thrive
they
more.
multiply in these cold areas.
Mm.
So getting exposure to the weather also plays a role. So you end up coming visiting the hospital. Yes, you know, when it's raining, every place, the weather, air, it's blowing, it carries a lot of bacteria in the air, and
Mhm.
then you just ingest them, or you just take some getting in contact with it
Yeah.
because the place is down. Let me say the place is down and there is a multiplication of bacteria.
Mm.
You can easily ingest it,
Mm-hmm.
then you take it.
Okay.
You see, that's when it's when the sun is usually shining,
Mm.
you getting this kind of conditions, though you might get, but you wouldn't get it on a high.
Okay.
You only get it on a high because the sun is really scorching and there is heat. So
Mm-hmm.
you the bacteria and kasano.
You can't thrive there.
Oh, better treat the kasano, better for you to even multiply at that end, I'm
No,
not sure you can even
it's
survive.
not, it's not a conducive
And
environment.
during this cold area, yes, this way they multiply, they really multiply in our animate and inanimate objects. So
Okay.
you can just get in touch with any of them. So of course, yes,
During the cold weather.
during the cold weather, people usually present with tonsillitis.
Okay. Then on the treatment, I almost forgot about this. Herbal remedies. We are in that part of the world, we do like herbal stuff. Do we have any herbal medications or is there herbal medication remedies to cure tonsillitis?
Okay. So um of course, so let me come to our herbal preparation.
Mm.
Now the world is changing.
Mm-hmm.
We have this good, let me say, good herbal preparations which have undergone scientific recognition
Okay.
that people take because we have our Noguchi,
Okay.
Noguchi
Yeah.
around where they dive into all those kind of things to um they dive into our herbal preparation. They go into it and they check. But those ones are clinically um made drugs.
Okay.
They've undergone through all this scientific experimentation.
Okay.
So we have
Has been certified
good
as
herbal
well.
medication that you can take, yes, that you can take, which can help. But when we come to our Ghanaian setting,
Mm-hmm.
people can just go to their farms or their backyard and just pluck a leaf and they will prepare. They will tell you they are preparing herbal concoction for it. For that one there, it's a no, no, no area. No one should try that.
Or
No
what if
one should try that.
they have
But
proof of it
says,
that it's worked? Because some will tell you, oh, I hear Juma Mama no, ebe boa won so.
so working for somebody, it's okay. It might work for someone, but it might not work for you.
Mm.
Because looking at the causes, you don't know the actual cause of it. You don't know whether it is a virus that is causing it,
Or
it's a
bacteria.
bacteria that is causing it, or
Mm.
it's a fungal that is causing
Mm-hmm.
it. You don't know. So
To
if it's working for A, does not mean that it's going
know.
to work for B.
Mm.
So that one we should also take note of that. You can't just go and pluck a leaf.
Mm.
Even when you go to people's backyard, even on the leaf car, you see that some dirt on it.
Yeah, it
You
has to be
see
properly
dirt
cleaned.
on the leaf. Yes. And if you don't prepare them well,
It's going to
you
introduce
can get.
another condition in the person. I'm saying that without properly cleaning and preparing it, it can also introduce another condition or another infection.
It can also uh, bring out another condition. You
Yeah,
can get your kidney problems from that, and because it hasn't been properly
prepared.
um, properly done or properly prepared.
Okay.
So there is another home remedy people also do, gargling of warm water.
Okay.
Sometimes even at the hospital, we recommend that. So
Okay.
you can be taking your antibiotics, but we do warm gargle. So you gargle warm water, especially with salt in it. So you put in salt in warm water, not hot water, just warm water. Then you gargle for like 2 to 3 minutes.
Okay.
Then then you try it just to reduce the pain and
Okay.
the inflammation process
It doesn't treat.
ongoing.
It's to
And
help with
other
the pain,
times, yes, so yes, for the pain and to reduce the inflammatory process.
inflammation. Okay.
And some other herbal concentrates that I don't know. Um, in my early childhood days, let me use myself as an example.
Sure.
You know, home remedy, you will be experiencing tonsillitis, and they will tell you that the superstition. So now let's come to they'll
That's
tell you you need to spit into fire, a fire.
wow.
You want to spit into fire. Some will also say that you want to spit into a toilet. Like, when you visit this
Mm,
public toilet,
toilet.
or even in your washroom, they'll tell you you spat into the bowl. Okay, it might have a slight
Yeah, because of the
um
the bacteria with the splash, it's likely to
yeah,
pick
this
some infection. Yeah.
yes, it's likely it has a slight um this, but people majority will tell you that when you in my early childhood days, when I experienced that, my first time my mother would tell me is that, hey, you've gone to spit into a toilet, or you've gone to spit
Into fire.
into a fire or a coal pot, like a coal pot.
For the fire and cool pot one.
You've gone to spit into it. So since you spat into it, then I think you that is why
Yeah, experiencing
your
the
tonsils are
mm,
inflamed. And with that, I can't remember, I should go in and fetch sand. Then buy our blue. You know the blue we use to wash our
hmm
things.
hmm.
I can't remember. I think it has this bed on it.
Yeah, the blue box.
Yes, the blue box, yes.
Yeah.
And then a chalk. You know the chalk
Mm-hmm.
we used to write on our chalkboards.
Mm-hmm.
Or sometimes our this from the one they usually eat.
Chile.
In our Ghanaian food, yes, Chile, the Ilo, yes. So She will go and buy it. Then she will ground it.
Mm.
Then she will put water in it. So in a separate three bowls, you have a chalk, you have a sand, a clay. It's not just any sand. This red clay soil. She
Okay.
will get some, and then the blue. Then you see them. They'll put one dot here, one dot here, one dot here, one dot here, one, and they will just design you with that. That when they do that, the inflammation or whatever, the tonsillitis you are experiencing is
Oh,
going to just
wow.
go. But frankly speaking, even after that, it
You still
didn't. I had to visit
the
the
hospital.
hospital. Right?
Oh my God. That's really interesting. Well, I didn't have tonsillitis. Maybe I had it, but my body found its way to fight it. And so I didn't have to go to the hospital for any medication. So I've not experienced this uh, home remedies during my childhood. That's interesting to know. Maybe there's someone on the call who might
It's
have
very
experienced it before. You can share your experience with us on the chat as well. I mean, it's been a wonderful discussion today, and I've learned a lot and been exposed to a whole new thing I've never heard before. And we are so grateful for making time to have this discussion with us, Nurse Grace. And I believe our audience have also had a wonderful time and enjoyed this discussion. We'll have to wrap up now and call it a day, and hopefully come back next week with another discussion. And so before I let you go, and then also appreciate our sponsors, any key take-home messages for us about tonsillitis, maybe the treatment, any key message you want to give to the audience for today before we log off?
okay. Um, what I'll tell you is don't sit at home and own remedies for yourself. Don't be a home nurse or a home physician to
Mm-hmm.
find remedies for your own self. When you're experiencing anything as such, and within 3 to 5 days, the symptoms you are experiencing, it's still there and it hasn't subsided, please kindly visit the nearest hospital because you might not know. It could be that you are experiencing um either a viral infection, a bacterial, or a fungal infection. So
Yeah.
sitting at home to get your own remedy, it's not advisable. So
Okay.
just go to the hospital, get tested, and get treated.
Okay. Thank you so much, Nurse Grace. It's been a wonderful time having you, and we hope to have you sometime soon again to discuss another important topic concerning our health. We are very, very grateful. Okay, so before you go off, let me quickly appreciate our sponsors. We have ABBA Partners, and they are also the sponsors of Your Salvation is Now Crusade. You can be part of us by calling the number on your screen, and they will discuss the terms and conditions that comes with becoming a partner, and you gladly be part of it. We also have Benbeni Travel Consults. They are located at Osufuriko Mall, and they deal with anything that has to do with travel, especially outside the country. So if you need assistance with visa applications, your documentation, you require documentations, concerning the purpose of travel, they are there to assist you. And so you can call them or visit them at their location. We also have Lightest Media, who is into graphic designing, branding, and printing of items, any item at all that you want. They are also into videography and photography for any event. So you can call them and they'll be there to assist you and get anything that you want done with regards to media. We also have Decovas Enterprise. So before you go to the lightest media for this and you need decor done for any event at all, you can contact Decovas Enterprise. She'll get that done for you. She's located at Tema Community 2, opposite the Tema Community 2 post office, not police station, post office, sorry. And we also have Prissy Logistics, who is into the import and export of goods. She's also offering door-to-door services. Whether you need any items freight management done for you, you can call her on the numbers on your screen, or you can visit her at her office located behind the Hunch Catering Service, Tema Community 5. Last but not the least, we have Rope Automations. They are located at Ajin Kotuku Amasaman. Ajin Kotuku Amasaman. They are into industrial works. So if you have to do any maintenance or you need machinery for batch plants, they are your best shot. And then we also have crash makeovers for your makeup for any event. If you need wigs done for you or revamping of wigs, you can also contact them and they will get that done for you. Okay. Um, also soon we have come to an end of the program. We've heard a lot today. If you just joining us, um don't worry, you can still go back using the same link to listen to the discussion that we've had so far on tonsillitis. We've looked at the causes, the care, and then the prevention. And to log off, I would say that tonsillitis is common, especially amongst children, because of the infections that they can easily pick around. And not all sore throats are tonsillitis. We have to know that. And it requires proper diagnosis, which is important to give the right treatment, because our nurse mentioned and has made us understand that it could be viral, bacterial, or fungal infection. And you can't tell by the feeling that you have in your throat. You need to go for you to be properly diagnosed as to what is the cause, and then the right treatment will be administered to you. And we also encourage to avoid self-medication, not only for tonsillitis, every other condition that we may have. Our health professionals who join us here have always been dwelling on the fact that we need to avoid self-medication, especially when it comes to antibiotics, because if you're not careful, anti you become resistant to these medications and it becomes very difficult to treat you at the end of the day. And early care prevents complications with this. Okay. And to remind us once again, Promise Land Faith Ministries is having a Christmas festival which started yesterday with a carol service at the Faith Temple. And if you missed that, don't worry, we have other programs coming up. This Thursday, what is 25th Christmas Day, is a glorious Christmas service starting at 8 a.m. at the Faith Temple located at Tema Committee 1 behind the Gold Filling Station. And then on Friday is a manifestation half night starting at 7 p.m. Same place, Faith Temple, Tema Community 1. And then it will be crowned on Sunday with the victory service starting also at 8 a.m. You are always welcome to join them fellowship. Thank you once again for joining me. It's always an honor to host you on the Health Talk Show. And until same time next week, it's bye for now. God bless you all. Thank you.